Thank you, Berkeley, so much. That was great. So while Theresa is walking up to the podium, I will introduce her. So Theresa Wittenberg is a physician's assistant at Stanford who works closely with me, a good friend and colleague. We recruited her to Stanford to help develop a survivorship program for neuroendocrine tumors. Some of you may say, what is survivorship? What does that mean? She is going to tell you that. She has also put together a survivorship fair that will occur during lunch with lots of tables and some giveaways, so she'll touch briefly on that as well. So thanks, Theresa.
Good morning. Thanks so much for having me here. I am excited to see this many people. And I get to talk about my favorite topic, which is cancer survivorship. So today I want to cover these topics. And if I keep standing close, I gotta see. I want to give a brief understanding about what survivorship is. I want to go over what a cancer treatment summary and care plan looks like. These are documents that are the hallmark of survivorship. And so I hope to go over that. And do some common symptoms for NET survivors. And then finally do navigating and optimizing your survivorship care. So let's start with a couple definitions. Who are cancer survivors? Anyone who's been diagnosed with cancer from the time of their diagnosis through the balance of his or her life. So there are many definitions for this. I like this one because I believe you're a cancer survivor from the time you're diagnosed. And historically, I think we used to talk about survivorship more of being a survivor after acute treatment. And I think one of the things I'm really fascinated about with NET survivorship is this idea of a chronic cancer and how we have to run survivorship and medical care in parallel. So what is survivorship? Supporting the unique needs of survivors with, through, and beyond their cancer. And cancer survivorship is a relatively new area in oncology. Adult survivorship kind of began and formed in about 2006, where we had this environment of, we had about 10 million cancer survivors at that time. We were getting substantially better at treatments. We were curing more patients, and we had advancing age in our population. So all of those things together kind of brought about this need for these patients who are in transition from their care. What do we do? What are we doing for them? Are we meeting their needs? And so the Institute of Medicine came out with a report identifying different needs for survivors. And their first one was to receive this treatment summary and care plan. And this is a concise and complete document to be given to the patient and shared with other providers that clearly states what type of disease, gives really specific details about what type. So for example, for a NET, what are you functional or not? And then this document is given so that we can share it with your primary care provider, maybe your local oncologist, and that we can kind of bridge the gap, which is our second point here, that we needed to do a better job coordinating the care with specialists in primary care. What was happening was at the end of treatment, oncologists would say, okay, you're done. They'd go back to primary care. Primary care wasn't sure what to do or what they should be looking for. And so we were trying to bridge this gap. And of course, the prevention, surveillance, and detection of any new or recurrent cancers, as well as consequences of cancer and their treatment. So really, in survivorship, we like to think about things that are impacted from your actual cancer type, and then the treatments that you had because of that cancer. And since the kind of initial starting of this, so I just went to a survivorship conference last weekend, and it's been about a decade since this report came out, and we are still trying to figure out how to implement that, right? Our healthcare system is really complex, and it's really hard to figure out how to deliver this kind of care and who's taking care of what. But we are really, really fortunate that we are in an area that we're in with very resource rich and are able to even have something as specialized as a NET survivorship clinic. So I do my visits, I like to think of them in kind of 3 different chunks. The first part of my visit is a symptom assessment. And I know you can't see this really well, but the idea is we give a form. This is either filled out prior to the visit, or I do it with the patient at the visit. And it's listed several symptoms, and you rate a severity of it. And at the bottom, it's kind of free text to say, do you have any other concerns? What are health goals that you're looking for? And this form really guides us with our visit. What things do we need to address? It's easily identifiable of what our priorities are to look at first. The second part of my visit is actually going over the treatment summary and care plan. So I prepare this before the visit. I collect medical records and make sure this is really thorough, but it's fairly straightforward. And I go through that with the patient to verify that this is what they know of their disease and what has been done. This is a several-page document, but the part after the treatment summary is the care plan. And what we do is, based on your disease type, and the treatment, we then make recommendations for follow-up and what things to look for. So, for example, if you had a platinum-based chemotherapy, let's say cisplatin or carboplatin, we might say, because of that, we are wanting to monitor your hearing, because hearing can be impacted using those drugs. So we would recommend an audiogram, a baseline audiogram, and then follow up for that. So we list all the things that we should be looking out for, what was the reason, why are we looking out for that, and maybe who should be following that, or how frequently that should be followed. And then we make wellness recommendations, and then finally we have a list of all the providers that are on your care team and who is going to manage what, because that's actually a really complicated part, and you all do this so very well, coordinating your care through multiple providers. Sometimes us providers don't do a very good job of that, in who's gonna take care of what, who's gonna monitor those labs, who's gonna get those scans. So this is meant to be kind of like a compact document. You can keep a copy for yourself, and also give it to your primary care, local, other specialists that you have. And then finally at our visit, whatever we've identified, I give resources and maybe make referrals and set up a healthcare plan for you, and also set some healthcare goals, because we want to do something about it, right? We want to make things better, so we're trying to be really proactive about how we can do that. So what are some of the common symptoms for NET survivors? Of course, we all know fatigue. Fatigue is actually the #1 symptom of all cancer types. And there's also sleep disturbance. I hear a lot about this. It's either the sleep onset or sleep maintenance. Pain, of course, neuropathy, decreased appetite. And we heard this morning about diarrhea and flushing. These are a big one for the NET survivors. And cough. I think the thing I want to highlight most today is actually the right side of your column, the right column. I think there's times we talk about symptoms and we think mainly about physical symptoms, right? Things that you come in and tell your doctor that are going on. If there's one thing I want you to get from my talk today, it's that there are a multitude of symptoms. Anything that has changed because of your cancer diagnosis or treatment from that is a symptom of your disease. So these start to include all these other aspects of your life. So employment concerns, fear of uncertainty, fear of the unknown, relationships with others, whether that's your spouse, your caregiver, your children, your coworkers, your friends. We also talk about cognitive impairment. So many patients are concerned about their memory. They just can't focus the same way. Insurance is a big one, and changes, and usually is in January as well. Anxiety and depression go hand in hand, and really, really needs to be addressed. And then finally, worry about our children. And I should have put on here as well, worry about families. So many patients are concerned about maybe their genetics and what does this mean for my family, right? What does my diagnosis mean? So in survivorship, I like to look at this more as a quality of life model in which we touch on different aspects. So physical aspects, psychological, social, and spiritual. And survivorship dips into all of those categories, and all of these are symptoms. So we talked about the physical, a little bit of the psychological, like loss of control. What does this mean? Anxiety, depression, fear of recurrence, fear of those scans that come up every 4 to 6 months, right? Or, you're doing okay, but then 2 weeks before the scan brings on some anxiety. Cognition, attention, we talked about. Just distress of your diagnosis and how that's impacting you, and coping. For social, this really impacts your family and can create some distress. Roles and relationships. This, I think, we need to address even more. I have a particular interest in caregivers and the care of caregivers. We're actually kind of talking about how can we make it so that we can embed a caregiving clinic within our survivorship clinic? Because caregivers are a huge foundation of the care. I think do not get the credit that they deserve and really are part of our healthcare team. And their health and their care for themselves is just as important, right? The patient-caregiver relationship is the symbiotic relationship that I think really helps each other. So we gotta look out for our caregivers as well. I have patients with issues of isolation, right? You're stuck at home, you have diarrhea, you can't get to work, feel very isolated, it's hard to get out with your friends for lunch. And so that we need to work on, right? I also feel that the things, even if we make just a little better, right? If we turn the 10 bouts of diarrhea down to 8 or 7, that does make a difference, right? We might not be able to improve it completely or resolve it, but improvements mean something. And then the spiritual category, a lot of patients struggle with uncertainty, their purpose, what the meaning of this is, and really want to explore more of their spiritual life. So some of you might be familiar with a survey, a real global survey that was done in 2014. This was of 2,000 net patients in 12 different countries. And I've only highlighted here the things kind of that we're talking about, but this was a really great survey. And I think it shows how much this truly impacts our population. So 92% had made a lifestyle change based on their NET. 60% said that their emotional health was affected either moderately or significantly. 58% worry about the uncertainty of their future. 43% said it affected them participating in their social life. And then 61% of those surveyed was not working at all. And of that 61%, 82 of them, it was because of their NET. And even those that were working, the majority of them were missing work because of their NET, missing days from work. So this is really quite impactful on patients' lives. I first saw this slide, like probably one of my first survivorship talks, and it has just stuck with me ever since. I like this slide for many reasons. There's actually 3 things I want to talk about. One is, as a provider, when we go in the room, I think there's sometimes patients that just seem like they got it all together, right? They're still doing things, they're still going to work. And I think it's our responsibility to ask some more questions, right? Dig a little deeper, ask the question, we've actually laughed in clinic. How is your sex life? We need to be asking these questions. And then the flip side is true in that I feel like we work in a partnership, and that it's the patient's responsibility too to maybe share with us the things that we're not seeing. And finally, this reminds me of caregivers as well, right? They're trying to keep it together. And so to kind of expose more of what's underneath is really kind of what we all need. So navigating your survivorship. I really encourage you to get your own treatment summary and care plan. And if you do not have access to a survivorship clinic, there are some online. So there's a Journey Forward is a website that does them. And then Livestrong does it through this link called OncoLink. And you can create your own. If you have your own information, you can kind of plug it in and it'll produce your own treatment summary and care plan. The only trick is that with us little zebras over here, there's no, they're mainly set up for colon and breast, and so we don't have a little category in those. But you can plug in an other category and plug in your information. If you are having some symptom that isn't being addressed, I encourage you, please make an appointment to specifically talk about that. If you don't know who it is that you need to go to, please ask one of your healthcare providers. If they don't know, they'll find a resource too. Have a plan for monitoring your health and coordinate your care through multiple providers. That takes a lot of work. I applaud you. I see how many appointments you have. And if you feel like you need help with that, there are resources for that as well. And then optimizing your survivorship. I think the first thing is to give yourself and your loved ones some time to process and heal. I think we so often, this spectrum of time that we have, it kind of takes some highs and lows, and there's times to just let it process. It's almost like we emotionally need to process after we physically heal, right? So be kind to yourself and listen to your body. We have many studies showing that exercise and physical activity improves fatigue and helps with your survivorship. So building strength and stamina, I hear this a lot from our patients. So we want to work on that and get an activity plan, an exercise plan. Of course, proper sleep and nutrition. We encourage you to speak up about those things. We have some resources for that. And attend outreach events. You guys are already optimizing your survivorship here today. Get educated, community resources, national resources, lots of websites, lectures, support groups. Get out there and get educated. You can also participate in research. This is an area I'm specifically really interested in, especially cancer survivorship research. So that's a way to get involved. Also any kind of fundraising, volunteering, there's lots of different ways. Just make sure you connect with others. And then I think in your booklet we have a list of the tables that are going to be at the survivorship fair. When we were in the initial planning stages for this, we thought it would be kind of fun to try this, to try to have a survivorship fair where we'd have different departments and disciplines come and share some information with you. And so we've invited many tables to come today. There is one change in the program, and that is our physician who is going to run the sexuality table needed to go out of town unexpectedly this morning, so that will not be happening today. But I'd love your feedback on different things maybe you'd like to see in the future. And I hope that you take advantage of that. That will be at lunch, during lunchtime, and then the afternoon break. So thank you for your time.